Are you suffering from the flu right now? Well, don't feel too bad, because 100 years ago, you'd probably be dead by now. The 1918 influenza pandemic, on Moments in Minutes. The 1918 influenza pandemic was one of the greatest natural disasters in history. Because it occurred during the First World War, major powers involved in the conflict censored reports of the outbreak. However, in neutral Spain, the local press was free to write about it, giving the false impression that the pandemic originated in Spain. Hence the label Spanish flu became associated with the event. In fact, the origin of the outbreak is still unknown, with scientists pinpointing the origin to either France, China, or the United States. The pandemic hit in 3 deadly waves. The first was between June and July in 1918. The second, from October 1918 to January 1919. And the third and last, from February to May 1919. The first reported cases of the H1N1 virus came from the state of Kansas in the United States in January 1918. Due to modern transportation, a lack of proper vaccination, and the close-quartered nature of World War I battlefields, the virus spread extremely quickly worldwide, infecting people in both developed and non-developed countries, and spreading even as far as remote locations such as the Pacific Islands and even the Arctic. Unlike most influenza outbreaks, where the victims are either young, elderly, and/or weak, the 1918 outbreak was unique in that the majority of victims were actually healthy young adults. This was because the virus destroyed the immune systems of healthy individuals faster than children, middle-aged adults, and senior citizens. Estimates of overall infection worldwide vary greatly. However, a conservative estimate is that around 500 million people around the world were infected, and anywhere between 21.5 and 50 million people died over the course of the pandemic. The 1918 influenza pandemic was the medical profession's first real experience with a pandemic and produced many advances in the field of medicine. When most of us, especially those of us in the developed world, get the flu, we are highly immune to its effects, and this can be credited to the advances in vaccination that began in the aftermath of the 1918 outbreak. Vaccines developed during the pandemic didn't prevent viral influenza outbreaks because the belief was that bacteria was the cause, not the virus. Researchers in the 1930s, however, finally discovered that the cause of the influenza was a virus and not a bacterium. This led to the development of proper vaccination by 1945 and the containment of worldwide influenza deaths to between 250 and 500,000 as of 2014. It is important to note, however, that since the 1918 pandemic there have been 4 other influenza pandemics, each presenting their own unique challenges to vaccine development and its effectiveness. Along with these vaccination breakthroughs was the introduction of the idea of medicine for profit. The outbreak caused an influx of patients throughout communal and military field hospitals. Doctors and hospitals had learned enough about influenza that they could properly treat the sick and began charging much higher fees than most people could afford. These changes increased the pay of doctors and encouraged many to enter the profession, and this is a trend that has continued to the present day. Close the gap between healthcare fees and people's individual incomes. The first health insurance scheme began in Dallas, Texas, in the United States, under the non-profit insurer Blue Cross. Blue Cross kept insurance premiums low in exchange for tax breaks. Commercial insurers who were initially skeptical of the medical field were persuaded to take up similar practices. In the 1940s, businesses began offering health insurance to compete for labour, opening up the market to private health insurers, which gave birth to the modern healthcare industry, which will spend as much as 9.3 trillion US dollars between 2014 and 2018. Thank you so much for your time today. Moments in Minutes is a channel dedicated to making history more accessible to you, the modern day scholar. We give you the what and the how, but more importantly, the why. Why history matters to you and the modern world. If you have any historical events that you would like me to cover in future videos, please let me know in the comments section below. And don't forget to subscribe to Moments in Minutes, creating history every week.